in.
Hi, my name is Sarah Hinojosa. I am a student at the University of Texas at El Paso. I'm a nurse practitioner student, and I'm going to do a practice physical assessment on my patient here, Mrs. G. How are you doing today, Mrs. G?
I'm well, thank you.
Very good. Before I entered the room, I did wash my hands, and Mrs. G's vital signs were taken. Her BMI was calculated. Her vision was checked using a Snellen test, and her all of her primary concerns were reviewed before I came in the room. Okay, and had she been a pediatric patient, I would have made sure that she had a hearing test documented, and then we would have documented her height and weight on a growth chart as well. Okay, so I'm going to just start out with, and throughout the exam I'm going to be assessing her demeanor, that she is alert and cooperative, dressed appropriately for the season, and that she's oriented ×4. So, okay, so we're just gonna, first of all, I'm going to start out assessing your head. And I'm just looking at her head to make sure it is held up, it's held erect and midline. I don't see any tremors, and I don't see any head bobbing, so it looks good. And your scalp, just looking at your head, it's a normal shape, she's normal cephalic. I'm going to inspect her scalp and hair. I don't see any lesions, scaliness, dryness, nits. No, looks good. Okay, and now I'm going to palpate your scalp. Just let me know if you have any tenderness. And I'm going to be palpating for any lumps, bumps, depressions, lesions, edema, and then see if she has any pain. Any pain?
No pain.
No pain. Okay, very good. All right, now her hair looks good. It's evenly distributed. It is well hydrated, and I don't see any breakage. So that's telling me that her scalp is healthy. If this was a pediatric patient, I would assess her fontanelles. The anterior fontanelle can be open up to the age of 2, and I would expect to find it slightly sunken and soft. Any bulging or tenseness of her fontanelle would be abnormal. Now I'm going to test your eyes. I'm going to do a few more tests on your eyes. This is also going to test your cranial nerves. So the first one we're going to do, we already tested the visual acuity, and so that confirmed that her cranial nerve number 2, her optic nerve, is intact. Now we're going to do something. I'm going to check your peripheral vision by checking your visual field, and this is by color confrontation. Okay, so I have these bottles, and I'm going to show you either one side or the other, and I want you to tell me if the color is the same or different for each time. Okay. Oh, actually, first I want you to cover one of your eyes. Okay, very good. Okay, now.
The same?
Yes. Okay.
The same?
Okay.
The same? The same? The same?
Okay, now let's try it together, right? Very good.
The same? 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 Same.
Okay, now uncover both of them, and then we do.
Same.
And we're just confirming her peripheral vision. And now I actually want to do, we're going to check for any lazy eye, weakness in the eye muscles, or amblyopia. Okay, so I'm going to cover one of your eyes. I want you to focus on something behind me. Go ahead and focus on the door.
Okay.
And just keep your gaze focused on the door. I'm going to cover one eye and then the other. And just continue to look where you're looking. Cover, cover. And I'm looking for any wandering eye. Making sure the eyes remain fixed on the object, both in the same direction. No drifting. Okay, very good. Now I want to, okay. I'm going to go ahead and check your pupils. So I would dim the lights, and I'm going to, here, hold on. Okay. Alright, I have my otoscope and I'm going to shine a bright light on your eye. Okay. Alright, and I'm checking for the pupillary response, both direct and consensual. And very good. Okay, pupils are equal, 3 millimeters and reactive to light. They are round and react both consensually and directly. And now I'm going to go ahead and look at I'm going to examine your inner eye. So it's going to be really bright light. I'm going to turn this to the brightest setting and a diopter of 0. So do that. Okay. And I'm going to first look for the red reflex. And once I find it, I'm going to go in. And I'm going to inspect the retina. I'm going to look for any hemorrhage, any lesions, and that looks good. And then I'm going to find the optic disc, there, and it is round, and the edges are clearly defined, and it is a light yellow in color. And I would do that for both eyes. Okay, and now we're going to do some other testing on your cranial nerves. So, okay, can you lift your eyebrows? Very good. And smile. Okay, clench your teeth. Okay, and puff out your cheeks. Very good. Okay, and then one more test for you. So I don't want you to move your head. I just want to keep you to follow my finger with your eyes. Okay? So just follow my finger. Very good. And that was testing the cranial nerve number 3, number 4, and number 6, the oculomotor, trochlear, and Deussens, using the 6 cardinal fields of gaze. And that was good. Okay, let's see. When you lifted your eyebrows, we confirmed that your cranial nerve, your facial nerve is intact. And then I just want to, let's see. Go ahead and clench your teeth again. Okay, very good. And that is your trigeminal nerve that we're confirming is intact there. Okay. Next thing we're going to do, I'm going to look at your outside eyes. So I want you to just close your eyes all the way. Very good. She closes her eyes completely and open them. I'm inspecting her hair. It is equally distributed. Eyebrows and eyelashes are full. And I'm going to look now at your sclera. The sclera are nice and white. No broken blood vessels or lesions there. I'm going to look at her. Okay, I'm looking at her conjunctiva. Look down, look up. Okay, and then the lower conjunctiva, very good. The conjunctiva are nice and pink and moist, and I don't see any lesions or discharge there, so that looks good. And I'm just gonna press kind of on your facial bones. Do you feel any pain there? Mm-hmm. Okay, or around your tear ducts. And then I'm gonna palpate your sinuses. Go ahead and palpate your maxillary. And then any pain?
No pain.
And then your frontal sinuses. Any pain there?
No.
Okay, very good. Now I want you to open and close your mouth, and then move your teeth side to side. Okay, very good. And then that feels good. It feels your joint there is good. And no, any pain?
No pain.
Okay, very good. All right, now I'm going to, let's see. We're gonna move on to your ears. So I'm gonna look just at the outside, at your outer ears, and they are symmetrical, and they're placed well on your head, and all your facial features are symmetrical. And let me look at I'm going to palpate your outer ears. Do you have any pain there?
No.
Or on this side? No?
No.
Okay, very good. And I'm just going to look at your outer ear. I don't see any lesions, no discharge of the ears. Okay, no edema, no erythema. Now I'm gonna try and look in your ears. Okay. All right. And for the adult patient, I'm gonna pull the ear up and back to visualize the tympanic membrane. So I'm gonna do that. Okay, and I'm inspecting her tympanic membrane. I don't see any hemorrhage. I see the bony landmarks clearly. The tympanic membrane is pearly gray. And I see the light reflex. It is not distorted. Okay, and I would do that for both ears. And then and if this had been a pediatric patient, I would pull the auricle down and back to visualize the tympanic membrane, and also make sure that she had a documented hearing test. Okay, now I'm gonna whisper some words, and I just want you to repeat them. So go ahead and include this with your finger. Include this ear. Okay.
Baseball.
Very good. Okay, now let's do the other ear. Okay. Include that ear and then
Apple.
Okay. Very good. So that confirmed that her cranial nerve number 8, the acoustic nerve, is intact. So now we're going to do, this is called the Weber test. And this is a tuning fork. So this is going to vibrate, and I'm going to place it right on the top of your head. Okay? Okay, tell me if you hear, do you hear the sounds equally, or is it one louder in one side or the other?
I hear it equally.
Okay, very good. And now we're going to do the Rhine test that tests the air-bone conduction. And I'm going to do this again. And here on the mastoid bone, I want you to tell me when you stop hearing the sound.
It stopped.
Okay, how about now? Yes or no?
I can still hear it.
Tell me when it stops.
It stopped.
Okay, and I would do that on both sides as well. Okay. Alright, now I'm going to look at your nose. And let's see. Her nose is midline. I don't see any bumps. On the bridge is nice and straight. I don't see any redness or edema. Have you had any nasal congestion lately? No? Okay. I'm going to palpate your nose. And there. Okay, any pain?
No pain.
Okay, I'm going to inspect the inside of your nose. So just put your head back a little bit. I'm going to look at, okay. And I'm looking at the septum I see no deviation of the septum. And the turbinates are small, and I don't see bogginess, or they're nice and pink and moist, no redness. Okay, very good, and I'll do the other side as well for all of those things. Okay? Okay, alright, now I'm going to check just your sense of smell. So I want you to occlude one nostril and tell me what this smell is.
Peppermint.
Very good. And now the other side. Occlude the other side. And tell me what you smell.
Oranges.
Okay, very good. Alright, now I'm going to go ahead and look at your mouth. Her lips are nice and moist and equal, and they look good. Okay, go ahead and open your mouth for me. Okay, very good. Teeth, let me get that light here. Okay, I don't see any cavities. Oh, sorry. One more time. Okay. So I'm going to look at her gums. Gums are nice and pink. I don't see any lesions. I'm sorry. Let's see. There we go. Okay. So stick out your tongue and say ah for me.
Ah.
Okay. And I'm visualizing the tonsils. And they're grade 1. Good job. And go ahead one more time. Just stick your tongue out. Yeah. And I looked at the hard and soft palate. There's no edema or lesions. Or redness. Have you had any pain in your mouth? No. Okay.
No.
Very good. And let's see. I'm gonna do. Oh, here one more. Just say ah real quick. Okay. I see the uvula is midline, and I'm just gonna check your gag reflex. Okay. So I have that.
Very good.
Okay. Okay. So gag reflex is intact, and the gag reflex. Tells me that her cranial nerves 7 and 9 are intact because she can stick out her tongue and she has the good gag reflex. That's the facial and the glossopharyngeal and the vagus nerves are intact. And then when you go ahead and clench your teeth, good. And that is the trigeminal nerve, number 5 cranial nerve is also intact. Okay, I'm going to move on to your neck. So, let's see, I'm just going to inspect it. And it looks good. Looks straight, no deformity. Okay. I'm going to palpate your salivary glands. In your lymph nodes. I'm going to palpate your lymph nodes.
No.
Okay, I didn't feel any swollen lymph nodes. What else? I'm gonna check your thyroid. So I'm just gonna move it over, press it this way, and then I'm gonna have you swallow. Good job. Okay, and I don't feel. Tell me if anything hurts.
No pain.
No pain. I don't feel any bumps. Nice and smooth. And I would do the other side as well of her thyroid. I'm gonna I'm gonna check your carotid pulse and listen for any bruits. Okay, I'll listen with the bell. Okay, and take a deep breath and hold it for a minute. Very good. No bruit heard. Okay, and again, I'm going to listen to your thyroid. Make sure there's no bruit over your thyroid. Okay, you can exhale. Very good. And then I would do the same for the other carotid on the left side. Okay, so then I'm going to look at your trachea. And I want to make sure that I can palpate it just above the sternal notch, and I don't feel or see any deviation. Do you have any pain?
No pain.
Okay, very good. Now I'm going to have you, I'm gonna press on your shoulder. Go ahead and shrug your shoulders. Very good. Okay, do you have pain?
I do.
Oh,
My right shoulder.
You're okay. Yes, you have a shoulder replacement scheduled next month.
Yes.
Okay. So as we're assessing your range of motion, please do not do anything that's painful.
Okay.
Okay. Just go as far as you can. Okay. So now I'm gonna go to your chest and I'm gonna go to your back. I'm gonna look at your back. I'm going to inspect the back. I don't see any lesions, no masses. I'm gonna go ahead and palpate your back. So I'm just gonna, from side to side. Any tenderness?
No.
Okay. Feeling diaphragmatic dullness. Here. Take a deep breath for me. Okay, hold it. Okay, and now I want you to, I'm gonna check for tactile firmness. I want you to say the number 99 for me.
99.
Very good. Again?
99.
Okay, and one more time.
99.
Very good. Okay, and now I'm going to palpate your back. Any pain?
No.
No tenderness? No pain? Okay. Alright. And then I'm going to palpate the spine. Palpating for any crepitus or okay, very good. Alright, now I'm gonna go ahead and check your radial pulses and your brachial pulses. Okay, and then I want you to, I know that you're not probably going to be able to lift this very high, but just lift your arms up. First, lift them to your sides like this. Okay, that's okay. All right. So with this one, lift this. Okay, I'm going to let you just rest that one. Okay, now lift them all the way over your head as much as you can with this one. I know this one you have replaced too. Okay, and now press down. Try to put it back at your sides. Okay, very good. All right. And then if you can extend your arms and curl both arms. Check the strength of your arms. Okay. And now just curl your wrists and extend your wrists for me. Okay, very good. And then do that one more time. Do it against my hands. Very good. And then, all right, push down on my hands. Okay. And then grab my fingers. Very good. Okay. All right. Now I'm gonna listen to your breath sounds. Start with your back. Okay. Oh wait. Actually, first I want to go ahead and palpate your chest. I'm gonna just look at your chest. Take a deep breath. Very good. You have equal chest rise and fall. I don't see any retractions, no nasal flaring. Her breathing's unlabored. So now I'm going to go ahead and percuss the chest. Okay, and that's good. I'm not feeling any hyperresonance or dullness. I'm going to go ahead and listen now. Just let me know if you get dizzy. good. I'll go around to the back. Okay. All right, deep breath. You good? Okay, very good. And your breath sounds are clear and equal bilaterally. And the head, looking at the back, had this been a pediatric patient, I would inspect the back, the lower back, to see if there is a sacral dimple or any tufts of hair or lumps that might indicate a lower spinal deformity. And now I think I'm going to go ahead and have you lie down. Okay, 45-degree angle. Okay. And just relax. And I'm looking for any jugular vein distension, and I don't see any. That's good. Okay, so then I'm going to go ahead and lower you all the way flat and listen to your heart. So I'm going to go ahead and listen to the S1, which is the fifth intercostal space, mid-clavicular line. Okay. And then I'm going to go here. And then to S2. Go to the aortic stem. Okay, so I was assessing the S1 at the fifth mid-clavicular space, intercostal space, the tricuspid at the fourth intercostal space, left sternal border, and then the pulmonic, and S2 is at the left sternal border, second intercostal space, and then on the other side, the right second intercostal space, right sternal border is the aortic area. And I did not hear any murmurs or rub in it when assessing the heart. And I'm just going to assess the rate and rhythm for a minute. Okay, and she has a normal, normal rate and normal rhythm. So now I'm going to move on to the abdominal assessment. I'm just going to look at it. Okay, just lift your shirt up. Okay, very good. And it is looking symmetrical. I don't see any bulges, no hernia, no abrasions, no lesions. Okay, very good. And now I'm going to auscultate for vowel sounds. Okay, vowel sounds are present in all 4 quadrants, and now I'm going to auscultate with the bell. And that was checking for a bruit in the abdominal aorta. And I did not hear any bruits. So very good. Now I'm going to go ahead and percuss for abdomen. So, and I should feel some dullness up here at the liver border and at the spleen. And gonna gently palpate your abdomen. Just let me know if you have any pain. Okay. Okay, now I'm gonna deeply palpate for the border of her liver. Here, below the intercostal border, and I don't feel anything. And then for the spleen on this side, and I don't feel anything, which is good. That's normal. Now I'm just gonna palpate for your kidneys right here. So. Okay, and then I would do the same on the other side. Okay, now let me have you sit up for a minute. Okay. Okay, and I'm just gonna check and make sure you don't have any tenderness, CBA tenderness. Does that hurt?
No.
Okay, let me know if there's any pain on this side either. Okay. Anything?
No.
Okay, very good. Alright, now to lie back down for me. Okay. I'm gonna assess the lower extremities, and the hair is evenly distributed. I do not see any lesions. Skin is intact. Everything is symmetrical. I'm gonna check your popliteal pulses. Here, let's see. So, okay, and I would do the same for both sides. Okay, those are 2+, and then I'm gonna, okay, and 2+, and then the pedal pulses are also 2+. Very good. Okay. I'm gonna check your range of motion of your lower extremities. So first your hip. I'm gonna flex your hip over your chest. Do you have any pain?
No.
Okay. We'll go ahead and push out as hard as you can. Push out against my hand with your foot. Okay. Good. And let's see the other side. Any pain?
No.
Okay, and then push up against my foot. I mean, my finger. Sorry, against my hand. Okay. There we go. Okay, very good. Now I want you to test your hip strength. So push out against my hand with your leg. There you go. And now in against my hand. Very good. And next to the other leg. Okay. Push inward. Very good. And then push out. Good. Okay. Now I want you to point your toes. Push against my hand. Point your toes. Very good. And now flex your feet. Very good. Okay. Just move your ankles. There you go. Okay. And now, I guess curl your toes. Oh, okay. Look, I noticed you mentioned that you had some pain on this foot.
Yes, it stubbed my toe.
Oh goodness. Okay. How long ago did that happen? I see it is red, and I see swelling and all around the nail bed, and I see some bruising under the nail bed as well. It feels pretty hot. I think we're gonna have to give you some antibiotics for that. It looks infected. Okay. Are you able? You can sit up now. And are you able to? I saw you walk in. You were able to walk.
Yes,
Okay.
I'm okay to walk.
Okay, but it's just.
It's really tender. Just
Tender.
It's
Okay.
Just it's uncomfortable.
Okay. Okay. All right. Next thing we're going to do. Oh, I also wanted to see. You mentioned that you had some scaliness, a red rash on your arm, on your
Yes.
forearm. Okay. And when did that start?
Not too long ago. I was playing with my cats, and I'm not sure if that's related.
Oh, okay. Yes. Actually, that red rash with the white in the center. And is it itchy?
Oh yeah, it's very itchy.
Okay. That is common. Cats can carry ringworm, so it is a fungal infection. We'll give you some medication for that as well.
Okay.
Okay, and so your pain in your shoulder. How would you rate it on a scale of 0 to 10, 0 being no pain and 10 being the worst pain you could possibly have?
Right now,